Rheumatologists treat all sorts of conditions, but we spend most of our time treating problems with joints where two bones, if you like, hinge. Inflammation in such a hinge is called arthritis, and depending on how you count, there are more than 20 types, all differing from each other in various ways and often needing different treatments. We also deal with problems affecting bones such as osteoporosis, muscles and tendons, and conditions which affect many body systems together. Arthritis is a term meaning inflammation in a joint, but does not tell you what type. A well-known one is rheumatoid, a surprisingly common condition causing pain and stiffness and can also be very exhausting. Untreated, it can lead to irreversible joint damage, but fortunately, modern treatments, particularly over the last 30 years, means it can almost always be treated, and the horrible pictures of rheumatoid arthritis that you might see in older books or online are a thing of the past. When I teach medical students nowadays, I show them what I think are my normal hands to show them what rheumatoid arthritis looks like nowadays. On the other hand, osteoarthritis, no pun intended, is not really a disease, but rather a process of wear and tear in the joints, a bit like forehead wrinkles, and we all get it to some extent. It is true that what you have done to your joints over the years, as well as other factors like genetics, can influence how likely your joints are to become worn, but at present we don't have any medications that interfere with this process, which is not to say that we cannot address the pain and disability that may be associated. At the moment, there are very few autoimmune diseases like rheumatoid arthritis that can be truly cured, but I view the treatment a bit like treating high blood pressure. As with high blood pressure or diabetes, for example, your body isn't behaving quite as it should, and taking medicine pushes it back to where it should be. But if you take the tablets away, the problem comes back again. In rheumatoid arthritis, a little bit of your immune system has gone slightly out of kilter, and medication is doing its best to try and push it back to where it should be. In other words, like when my son-in-law looks at the tablets I take in the morning and says I'm an old man because I'm taking all these tablets, and I retort that I'm an old man because I am taking these tablets. As I have already said, rheumatological disease can usually be recognized by talking to and examining a patient, and various scans and blood tests are usually dotting the I's and crossing the T's, but can be important particularly when making sure that treatments are not upsetting the body in any way. At the end of the day, even in the short span of my career, I have seen dramatic improvements in the quality of life that patients with rheumatic diseases enjoy, and risk making my job redundant, which I suppose is the best one can hope for as a doctor.